Hey guys, and welcome back to the show. I am your host, Megan Hardy, and today I'm joined by Dr. Christine Maren, a board certified physician and functional medicine expert who helps women navigate perimenopause, menopause, and thyroid health. And in this episode, we're going to talk about the importance of muscle for hormone health, blood sugar, and metabolism, especially for women over 40. And we're going to touch on thyroid health and its impact on HRT, hormone replacement therapy. Dr. Maren brings both her expertise and practical strategies to help women in perimenopause and menopause take charge of their health. So I am really looking forward to this conversation. Dr. Maren, thank you so much for being here and welcome to the show.
Thank you. Thanks for having me.
Yes, absolutely. Would you just share with our listeners a little bit about you to get us started? Anything I left out in that intro, your expertise and also just a little bit personal about you.
Yeah, so I mean, on the personal side, I'm a mom of three. I'm in my 40s. Most of what I practice is because I've been through my own health journey and I figured out a lot along the way. And of course, I've seen women for the last decade in my functional medicine practice and learned a lot from my patients as things have gone. And in my practice, I really focus on root cause medicine. That's that whole piece that's like this functional medicine lens. And I focus on hormone optimization. And so that is for a lot of women in perimenopause and menopause, estrogen, progesterone, also testosterone and thyroid. I talk a lot about thyroid health and also stress and chronic stress and how that really layers into our lives as women, which I think is really common and prevalent. I've got that framework, and then I've got my five foundational health habits. One of those is strength training and movement, as well as nutrition, low tox living, sleep, stress, and mindset. And so, from a professional standpoint, my functional medicine training was, started about a decade ago and really was born out of fertility complaint or really fertility issues that I had. I had recurrent miscarriages and I knew there was something going on with me. I didn't get a lot of answers in the conventional, from a conventional standpoint. But I'm board certified by the American Board of Family Medicine, Institute for Functional Medicine certified, and I'm also certified by the Menopause Society.
I did not realize that about you. I had my own miscarriage, so it's like you don't realize how big
Yeah,
that tribe is until you're in it.
yeah,
And you're like, oh, okay. And I also can really appreciate that you're like, okay, what is some of the root cause here? Because it's common but not normal.
yeah,
I think
exactly.
we're
Mhm.
told it's normal, but really you're like, no, it's not. It's common, but what's going on
Yeah.
here? So that's really what fueled you to kind of get into the functional health side.
Yeah, I mean, I had a lot of things going on at that time, as most of us do. It's usually that not one little thing. It's like gut health and thyroid issues and hormone imbalances and mold exposure. And, it's just a big soup. So, kind of unpacking all of that took years and also, got me a lot of good experience and helps me take care of women who have complicated issues. I mean, I think
Mm,
we're all truly complex, right? Like,
hmm.
our health just
Agree.
isn't super simple. Like, it just isn't.
Yeah, I'm going to reuse what you said. I'm going to use that now and call it a soup because it definitely feels like soup
Yeah.
a lot of the time. It's just like, what is going on and what is in here, you
Yeah.
know? So being able to peel back the layers of that and like figure out what the ingredients are in the soup. And actually, so with our topics today, I reached out to you on social media because I saw a post of yours and I don't even remember how I came across your page, to be honest. I think it might have been another podcast you were on, possibly. And I was like, oh, let me follow this person. And then you posted about muscle and how it's so underrated for hormone therapy and for women in their 40s. And I was like, this, she sounds like my people
Yeah.
with
I'm a big
muscle.
fan of muscle.
Yeah. So I was like, I need to have her on the show. I did some stalking and then I was like, I would love to have her on. And I just want to, I mentioned this before we start recording, but give, Dr. Maren props too. When I reached out, she was like, yeah, let's do it. And I always appreciate when people are like, yeah, let's go, why not? And that's how I try to be too if people approach me for podcasts. So really excited for this conversation. And I would love if you could just kind of touch on that post first, and then we'll jump more into thyroid and how it impacts HRT.
Yeah.
But the post said, I have it written here, you said muscle is the most underrated form of hormone therapy and one of the best things you can do for metabolism, blood sugar, and body composition after 40. And if you could, just from your own lens, like I feel like my audience
Mhm.
gets to hear me talk about some of these things, but just hearing it from someone else and an expert in this space can be really helpful. So, would
Yeah.
you just kind of give your lens on muscle and its impact on metabolism, blood sugar, and body comp for women?
Yeah. I mean, skeletal muscle it does a lot of things and they're all good. Um,
They're all good.
I mean, there's a lot of like, where to even start? I mean, from a blood sugar standpoint, muscle is really important for insulin sensitivity. And as women go through menopause and perimenopause and they have a decrease in estrogen, often it's accompanied by something called sarcopenia, which is age-related muscle loss. And we can prevent that, but we have to be ready for it. You know, we have to be proactive about that. And maintaining our muscle often requires some hormone therapy to help. But muscle itself is like the number one thing that we can do for longevity, for blood sugar and insulin. Um, it is anti-inflammatory. There's even studies looking
Mm,
at how patients who are post-cancer have done with recurrence after chemotherapy, and they do better if they have more muscle, if they're lifting weights. And
whoa.
so strength training doesn't just help the blood sugar piece and the metabolic piece, it also helps the immune system piece. It's also really important for women with autoimmune disease. I mean, I think it's like it's underrated. There's so many patients I have who are doing all the things. They're often like on a limited or restrictive diet. And
Hmm.
sometimes they are, I mean, they're taking like 5 million supplements. You know, they're doing
Hmm.
a lot for their health, but they're missing this one really critical aspect, which is lifting weights and preserving muscle mass. So,
Ugh. And I appreciate too that you mentioned the autoimmune piece as well. Because a lot of so I work with clients in nutrition and fitness, and I would say almost
hmm
half
hmm
have hypothyroid or even
yeah,
Hashimoto's. And it's like, oh my gosh, was this always a thing and we're just not realizing it? Or more and more women, you know, getting this and
yeah,
having this.
yeah.
Um,
It's
yeah.
more and more women getting it and having it. The rates of autoimmune disease, especially autoimmune disease among women, is really huge. And I think part of that reason is women are so overextended. We
Mm,
are just we take on a lot. There's a lot of cultural background to it. And again, it's like the soup. It's like we take on a lot. Women tend to be really overly, I shouldn't say overly, but women tend to be really productive and are often very capable and highly responsible. And those are the women who end up often with autoimmune disease. I've seen this pattern over and over in my clinic. I've seen it with myself. I mean, I had autoimmune disease. This is like a pattern I've played out in my own life. And
mm.
there's a lot of good that comes from it. We're really capable, resilient. You can depend on us, but like ultimately, it adds up and it creates health issues. And some of the downstream effects are often autoimmune.
Mm. Gosh, it's so real. I don't know if you've seen there's a reel that's like, I wish that relaxing could be more productive or something
Yeah.
like that. Just speaking to the woman who's not good at relaxing, we're just always trying to be productive, but then it kind of comes at a cost
Yeah.
too,
Exactly. Yeah.
yeah. So as far as muscle, it can even impacting metabolism and then the blood sugar component, but then even like immune health and
Yeah.
autoimmunities too.
Yeah.
So
Yeah, and I
huge.
think this is a good, important misconception to sort of bring up too, because a lot of women who have autoimmune disease are under the impression that they shouldn't exercise. They've got this message like, oh, my cortisol's messed up, I shouldn't lift weights or I shouldn't exercise. And while I agree that they probably shouldn't like run a marathon or train for
Mhm.
like an Ironman, lifting weights is one of the best things they can do. You know, it is one of the best things we can do if we have autoimmune disease. It also just helps with cortisol, actually. Like it gives us, you know this, like when you lift weights, it gives you this different source of strength.
Mhm.
And sometimes I have a hard time like putting the science on it exactly, but it helps with stress and it helps with emotional resilience and strength. There is something about
Yes.
lifting weights that does that. Am I right?
Oh, you're right. You're so right. I'm like, yeah, mic drop. Yeah. No, and it's like the acute stress of lifting weights. And it's that stress in the moment, but it really does make you stronger, not only physically, but then also translates to other
Hmm.
aspects and areas of life so
Yep.
much. I'm
Yep.
such a firm believer in that. That's so, so good. Well, if we could jump into our topic, because I think this can be like a very meaty conversation about thyroid health and its impact and link to HRT as well. If
Hmm.
a woman is, contemplating or on hormone replacement therapy, that I will tell you that's a lot of our listeners are perimenopause and menopausal ladies, either on HRT, thinking about it, have been on it, it didn't go
Yeah.
as planned, all the things.
Yeah.
So one thing to kind of open up this conversation, I'll leave, open the floor to you, but a lot of women who have tried HRT, they tend to still feel like they're like still feeling tired and
Hmm.
foggy, or they're still struggling with their weight. And could that be a thyroid
Hmm.
health link
Yes.
as the missing piece? If you could,
Yeah.
yeah.
Yeah. I think there's a lot of missing pieces. Like HRT is not a panacea. It's helpful. That's why when I talk about this framework I have in my clinic, it's like address the root cause and optimize hormones and work on these five foundational lifestyle habits. But addressing the root cause is a really big deal. If you go on HRT, but you still have some underlying gut infection or a microbiome imbalance, like gut health is also really important on how you do on HRT. And so is thyroid. So thyroid is a little complicated because is it just suboptimal thyroid levels and or is it Hashimoto's? So if it's Hashimoto's, that's a really common underlying autoimmune condition that over time causes hypothyroidism. It's very much undertreated. Well, I should say it's underdiagnosed. A lot of women aren't
Mm,
tested for it. They have no idea that they know that they have Hashimoto's. And so there's a lot of overlapping symptoms between women who are in perimenopause and women who have hypothyroidism and Hashimoto's, like a ton. It's really hard to differentiate. And so that's where labs come in. I mean, that's where, yes, we can walk through symptoms. And there's some things like thinning of the outer third of the eyebrows more common with hypothyroidism than it is with perimenopause. But like thinning hair is common with both, right? So it's hard. Fatigue, it's common with both. Irregular periods could be both. Like there's a lot of overlapping symptoms. So labs are important. And if you start HRT and your symptoms are not any better, like even more reason to get more labs.
mm. And that's was one of my questions for you actually was like why do so many thyroid problems get missed with
Yeah.
standard lab testing? And then what labs should women really be asking for when they are?
So most doctors, when I did my family medicine residency, most physicians are checking just a TSH. And TSH is a good lab, but we need a lot more than that. Some physicians will check a TSH and a free T4. So free T4 is going to be really important. Sometimes people have a normal TSH, but it's a low free T4. That's another condition, but that's a problem. That's a type of hypothyroidism. So for women in my practice, I'm checking a TSH, I'm checking a free T4, also a free T3. So you convert T4 to T3, and T3 is your active hormone. I also like to check a reverse T3. So for women who are underfueled, which if you're lifting weights and you're not fueling appropriately, you're not going to be in a good, anabolic state. You're not going to gain muscle. If you're underfueled, often we'll see a high reverse T3. And that's a good sign that there's just too much stress. Like there's too much stress on the organism. You're underfueled. Like there's a lot of inflammation. There's other things going on. And then to identify Hashimoto's, we can check TPO or thyroid peroxidase as well as TG, thyroid globulin antibodies. So those are usually common in patients who have Hashimoto's, not always. We can also do a thyroid ultrasound. There's other kinds of investigations we can do, but that full thyroid panel is TSH, free T4, free T3, reverse T3, thyroid peroxidase, and thyroid globulin antibodies.
Oh, so good. Oh, I love it. You're just like, boom, boom, boom. This is it.
I do it every day.
Yeah, you're like day in and day out. Well, and it's just so many. I can't tell you how many like clients I've had who are like, yeah, I got my thyroid tested, and I'm like, what did they test? And they're like
Yeah,
TSH, and all is
yeah,
normal.
yeah,
Um, could you kind of speak to that too? Like, and I've had even had clients who have gone in and said, like, can I get a full thyroid panel? And then, it's still they just get TSH tested. Like if
yeah.
coming from a
Hmm.
doctor and someone, practices functional health, like why is that? Or
Yeah. Yeah,
yeah.
I mean, doctors, so a lot of times how it's ordered is a TSH with a reflex to free T4. And that means the lab's only going to check your free T4 if your TSH is outside of the reference range. There's some controversy behind the reference range. American Thyroid Association, American Academy of Family Physicians, like everybody stands behind it now, behind that reference range. But the reference range is based on a sick population. It's based on people who have hypothyroidism. And so there's optimal, and then there is the normal reference range. And so the reference range usually goes up to around 4.5, depending on the lab. And so unless your TSH is above 4.5, you're not going to be identified. Even if it is above that number, so if you're between 5 and 10, that's subclinical hypothyroidism, assuming your free T4 is normal, and so you wouldn't be treated in most cases. Sometimes they'll treat you if you have signs of Hashimoto's, which just isn't checked enough. Like it just missed so often. So
Mm.
part of the reason it's not checked, I mean, I think a lot of it is honestly financial. Also, when you see a primary care doctor, they know a lot, but they know a little bit about all this stuff, right? They're not a specialist. They don't do thyroid. They don't do Hashimoto's. They don't know. They're always like the preconception lab just like they're good doctors a lot of times. Like they've
Hmm.
got a lot of training and they don't know everything and sometimes they miss some things, you know? It's just it is what it is. Also, there's no big certifying body that's pushing like nobody knows what a full thyroid panel. Like if you say that to a normal conventional doctor, like that, I don't even know if they know what that
They're
means. You
like,
know what I mean? Free
yeah.
T3 is just really underchecked. And even if it is checked, if you have an open-minded doctor who's like, sure, I'll check it for you. A lot of times they don't know what to do with the information because it's not something they do a lot. And the reference range for free T3 grows really low. And so you're not going to be flagged as having a low free T3 unless you're really, really low, like in the
Mm.
pits. So kind of that's the thing with thyroid. It's like unless you're really in the pits, like it's not flagged on your lab. So
Yeah.
you kind of have to understand like what do these optimal lab ranges look like? And then make some decisions from there. As a just like a broad kind of one, I'd say free T4 and free T3 should be in the upper side of that reference range. But
Mm.
my optimal range would be to get TSH like somewhere between 1 and 2, to get free T4 at least above like 1.2, 1.3, 1.4, 1.5. That is good. Sometimes I see it at like zero point 0.8 or zero point 0.9, which is low. And then free T3 in the threes, like 3.2 to 3.8 is like the sweet spot.
I love that you mentioned the optimal range versus normal range and that point of like that's looking at like a sick population or
Yeah.
people struggling with their thyroid, and so really we should be looking at the optimal range because it just gets thyroid issues get missed so much.
Yeah.
Actually, I have a family member who's not someone who's working with me, but who was asking for advice, and I like told her over and over again, I was like, please go get labs and see a functional health practitioner. Like I really think there's an underlying thyroid issue here. And she's like, I had my thyroid tested. I'm like, no, you didn't.
Yeah.
And I'm like, just all the symptoms point towards that. And I actually was wondering if you could address some of those even thyroid issues that you see commonly show up in, especially in perimenopause and menopause, so women might know what to look for.
Hmm.
You already mentioned some that can be, you know, between
Yeah.
perimenopause or thyroid, like thinning eyebrows, things like that. But what would be some things that would be like maybe thyroid issues?
Yeah. So sometimes women will experience cold intolerance. So like it's like a cold to the bone, like you can't warm up. Constipation sometimes, but sometimes it's just like IBS kind of symptoms. There's a big feedback between thyroid and gut. And so sometimes it's just this dysmotility. Sometimes it's like bloating or belching or low stomach acid, something like that. Fatigue, just being tired, not getting enough sleep or not feeling like you get enough sleep, is a really common one. Dry skin, hair loss, thinning hair, thinning of the outer third of the eyebrows. Infertility is another really common one. Recurrent pregnancy loss is really
Mhm.
common. Changes in the menstrual cycle could be related to thyroid for sure. Um, what else? Depression, anxiety, kind of mood related issues can be thyroid related also.
Mm.
I see a lot of people, it's different. Like some people are more sensitive to thyroid perturbations with their like brain health and their mood than others. But it can be a really
Interesting.
huge impact for some women. Like they'll struggle a lot with mood. Um, what am I missing?
Which is so you can just listening to you, rattle all of these off. It's like it's easy to see how it can be very confusing for someone in perimenopause.
Totally. Like there's so much
Like,
overlap. And perimenopause is this time of unmasking. I call perimenopause, I say it's the unmasking effect. So what I mean by that is like as we lose hormones, we lose some resilience and any underlying issues
mm,
become more obvious. And so
mm,
maybe you had some subclinical hypothyroidism and you were fine in your 30s and then you hit perimenopause and like things get worse because we're not as resilient when we don't have as many hormones or when we have these like fluctuating hormones. It just is harder for us. And so there is this element of that. And we know that perimenopause and menopause is a big risk factor for developing autoimmune disease, just like postpartum is, right? So when
Hmm.
women are postpartum, we know
Yeah.
that's like one big, huge time when women experience a lot of autoimmune issues and onset. Same thing happens as we go through perimenopause and menopause. There can be a lot more increased autoimmune activity happening. And so just knowing too, like, okay, well, all the more reason to get good comprehensive labs, in my opinion.
So good. So good. Also, could you speak to, or I guess I'll ask the question, like, as far as estrogen, progesterone, and like, especially in perimenopause when things are just kind of like, whoa, all over the place, can fluctuating estrogen and progesterone levels impact thyroid function? And like, and if so, how
Yeah,
do
that's a
they?
great question. And one to just kind of like backtrack a little bit because with lab testing, thyroid labs are I would say more reliable than hormone testing because hormone tests are so variable, right? So if we go
Hmm.
check estrogen, I still check those labs in patients, but it really does depend if you're in perimenopause, what part of your cycle was this drawn? Like
Yeah.
did we, check it at a time when it was really high and then a time when we're really low? So I like to get multiple data points. Estrogen, when it's really high, can increase things like thyroid binding globulin and sex hormone binding globulin. It's a similar effect as when we're pregnant, but less. So when a woman is pregnant, let me just back up. So when a woman's pregnant and she checks thyroid, like we have to monitor it really closely because your estrogen levels go really high when you're pregnant, like into the thousands. So they are much higher than when you're in perimenopause. But if you have that spikes, but
Hmm.
so when that happens, women make more SHBG, sex hormone binding globulin, and TBG, thyroid binding globulin. Those are proteins that bind up hormones. And so in pregnancy, we know a woman is more likely to be hypothyroid because she has more SHBG and TBG. And so she'll need more thyroid medication or more support. The same thing can happen in perimenopause, but it's less of an effect. I don't see it as much, but high levels of estrogen can cause more SHBG and bind up more thyroid hormone, so making it less
Mm.
bioavailable. On the other hand, estrogen is really important for thyroid hormone receptor sensitivity. So your thyroid hormone is going to work better if you have estrogen. So if you have really low levels of estrogen, less of an effect on SHBG and TBG, but your thyroid doesn't work as well. Muscle, by the way, influences that thyroid hormone receptor sensitivity too. And
Muscle.
conversion between T4 and T3. So, like, remember, T4 is the kind of raw material, T3 is the gas that interacts with your receptor. And so, muscle is helpful there. Estrogen is helpful there. Gut health is really important there. So, thyroid itself is like, it's a lot more complicated than, just check a thyroid. Like, yeah, there's a lot that goes behind like how do we optimize thyroid function, like gut health, muscle, stress, hormones, nutrients. There's a bunch of
Mm.
nutrients that can affect thyroid conversion and our ability to make thyroid hormone. So it's complicated. There's a lot that's in there, but just to like keep it simple, yes, your hormones will influence your thyroid hormone receptor sensitivity, but usually estrogen is favorable, I would say overall. It's just you have to be more careful when you're taking oral. So I think the times to be the most cognizant of are birth control pills. That's a huge one, and pregnancy. Outside of
Hmm.
that, if you're taking oral estrogen, like for perimenopause, some women will take oral estradiol. That could influence transdermal estradiol, doesn't generally cause an issue like where you would need more thyroid hormone.
Okay.
Yeah.
Mm. Yeah.
Oral versus cream. So transdermal, like most women in perimenopause are using transdermal estradiol. And so if they're on transdermal, like a patch or cream or gel or whatever, it's not usually going to affect thyroid hormone as much, or if at all. I still check their thyroid labs always after we start HRT for sure.
So
But
mostly favorable with estrogen, but it's still kind of like a
mhm.
Goldilocks effect of like you
Mm.
don't want too
Mhm.
much, but don't want too little as
Yeah, I
far as
mean, too much of
so
a good
it's a
thing
good
is
thing.
a bad thing,
Yeah. Yeah.
right? Yeah.
So good. Well, and also you kind of touched on this a little bit, but as far as gut health and the tie to thyroid function, could you speak to that just a little bit more? Like, how does gut health tie into thyroid function and then almost also like hormone balancing?
Yeah, it's super bidirectional. So gut health and thyroid hormones and sex hormones are bidirectional, meaning they influence each other. So it's a big one. So when we talk about thyroid and gut health, so gut health is one of the main. points of interest in any patient who have autoimmune disease. It's often this issue with intestinal permeability. So in patients with Hashimoto's, like the gut health piece is going to be a really big deal because of the autoimmune component. Gut health is also going to determine how we're absorbing nutrients, and those nutrients are really important for making thyroid hormone. So things like iron, vitamin A, B complex vitamins, D, zinc, selenium, all of those are important for either making thyroid hormone, T4, or converting it between T4, T3. I didn't even mention iodine. Iodine's important, though it's
Mm,
very Goldilocks. You have to be careful with that one. And protein. So amino acids are really important for making a thyroid hormone. Also carbohydrates. So this is a really big one and interesting for probably your community.
yeah.
I'm a big fan of really good, healthy, complex carbs. I think a
Mm,
lot of women are trying to lose weight and they're on a low carb diet to try to lose weight. Now it's very individual. Some people have blood sugar issues. They have to be low carb, but like the more muscle you have, the more carb you're going to tolerate. And the
yes.
carbohydrate's really important for thyroid conversion. When you give your body more carbs, you're usually signaling like abundance, like, hey, I'm good here. I've got
Yeah.
enough resources. I'm not underfueled. And so your body does a better job of converting T4 to T3 versus diverting it to reverse T3, which is going to be like the metabolic breaks.
Oh, that's so
Well,
good.
let
And
me
that's,
back up because I told you, like, okay, so
yeah.
that's how gut health is important for thyroid, but then thyroid's also important for gut health. Thyroid determines things like motility. We know patients with hypothyroidism are often constipated, but like I mentioned also, they sometimes have this dysmotility or issues with like sometimes it's IBS kind of symptoms. Like a lot of there's a lot of overlap with a gut infection called SIBO, and so that's a
Mm,
big one too. So it's also going to influence like your digestive enzyme secretion. How's your stomach acid? Even saliva can be influenced by thyroid. So patients with hypothyroidism often struggle with good digestive enzyme function overall.
oh my gosh, there's so many things there still
Yeah, it's a
to
lot,
like
right? So it's
unpack.
like a big
Yeah.
soup.
The soup. Well, and so like and you get this information back and it's like, whoa, these things are off. But um I think I know how you might answer this, but like when you're addressing these things and you're like, okay, thyroid markers are off, or like you have all these symptoms too, like
Mhm.
you're also basing it off the patient or the client's symptoms as well. What are you attacking first, or are you like attacking all of these areas kind of at once? How are you approaching
Um,
it when it's like, oh,
yeah.
there's might be some gut permeability, thyroid's off, sex
It's
hormones are all
usually
over the,
all of
yeah,
the above. Yeah.
all of you.
I mean, I don't ever like we take things in a stepwise approach. I don't.
Yeah.
There has been a time when I'm like, let's start estrogen, progesterone, testosterone, a GLP-1, and gut trait. Like that's too much here, right? So we've got to like sort of pace ourselves. And so
Yeah.
in my clinic, how we do it is like, let's get the labs. So we've got some data we'll sort of start trickling things in. So if I've got like somebody who I know is in perimenopause and she's got some symptoms suggestive of low progesterone, I might start her on that so that the next visit I can layer in estrogen. Or if we see that her labs are really off, then I'll layer in thyroid medication. And so we just kind of
Mhm.
layer things in one at a time. And then I check labs like every 6 to 8 weeks. And that's when I work with patients, new patients, we see them, we check labs every 6 to 8 weeks and, kind of build up to like what else do we need to layer in? And it's sort of like this unraveling, but we can't just do it all
Mm.
at one time, right? But simultaneously, as I'm working on optimizing those hormones, I'm also treating underlying gut infections. So if there's an underlying gut infection, like, okay, that's part of the protocol. We're going to start treating this and replacing some nutrients. So, it just depends on the patient. We try not to do things that are overwhelming. I always tell patients, like, this is your plan, it's not mine. So let's talk through like what does this look like and how quickly do we want to do this? Like I can throw the kitchen sink at you. The risk is we're not going to know if you have a side effect what it's from, but sometimes that's
Yeah.
the right answer if somebody's feeling really bad. And so we just kind of talk through like kind of this layered approach. Like and then we decide how quickly can we go. So it
So
really just
good.
depends. I mean, I wish there was like this simple answer because I get that question all the time. Like, what do you do first? I'm like, I don't, it's hard. I would say the
Yeah.
first thing is encourage people to show up for themselves.
Oh gosh. Well, and I can appreciate that because like if you're throwing too many things in at once, then you don't know what's maybe if there's side effects, you don't know what it was that caused it. And also if something's working, you're like, we
Yes.
don't really know what it was, the lever that
Yeah.
we pulled to
Yeah.
do that.
Yeah.
So
Yeah. So I usually like if I'm adding multiple things, I'll have them you know, add this first. If you have side effects, let us know. If there's positive effects, take note. Like I want to know
yeah.
what's helping and what's not because um it does help when we have data because it's not like we're throwing mud at the wall. Like at least we have data, we know what we're doing and why. But, if you try something that you haven't tried before, it can be tricky sometimes.
Yeah. What testing are you doing for to identify underlying gut infections?
So I do organic acid testing in the urine. I like to look at all those fungal markers, bacterial markers. I also do breath testing, lots of like a SIBO breath test. And then I'll do stool testing as well, like a PCR stool analysis. So those are kind of my favorite three when patients are struggling with gut issues or they have autoimmune disease. Um, yeah.
How often do you see overlap with someone who comes in thinking they maybe have thyroid issues going on who also
Mhm.
has those underlying gut? Like how much overlap do you see?
Oh, so much overlap. I mean, I would say the gut issues are really, really, really common. And so any patient who has Hashimoto's, I would say 90% of them have some underlying gut issues going on. And a patient who has hypothyroidism, it's hard to say. Like you can have hypothyroidism without Hashimoto's, of course, right? And
Mhm.
so I would say there's probably less, but I don't know. I'm just guessing 70%, 60%. I don't know, the majority.
The majority.
But I
Yeah.
would say the majority of patients, even without hypothyroidism, have some sort of underlying gut issue going on. I mean, in our modern day world, we're exposed to things, pesticides, antibiotics, stress. Most of us have an imbalance with our gut microbiome. And just to accompany that, we didn't really get to this part yet, but as you go through perimenopause itself and the withdrawal of hormones will affect the gut microbiome and shape the gut microbiome in a really distinct way. So we see in studies sexual dimorphism, men and women have very different gut microbiome. A woman's gut microbiome starts to plateau around age 40 and she begins to lose diversity after that.
Mm.
And I mean, studies would attribute that to perimenopause or menopause and the change in hormones. So, that in and of itself, just those hormonal shifts and changes are going to affect our gut microbiome as well.
And that's super interesting. And what's some of your recommendations for as far as helping with gut diversity for women in perimenopause and
Yeah,
menopause?
exercise. Here's another one. Gut microbiome benefits from movement and exercise in a huge
So
way.
cool.
So, like, work out. That's super important for your gut microbiome and I think really underappreciated, right? People are
Yeah.
taking probiotics, but like actually I
Yeah.
think what's more effective is exercise. So, I do also use probiotics and recommend specific like spore form probiotics for my patients for sure. So, it's another way. Diet super important in getting fiber. So, this is another place where complex carbs come in. You can get a lot of great fiber from different kinds of fruits and things like oats and all sorts of complex carbs. We can also get fiber from things like avocados, but having diversity in our diet and eating a good amount of fiber is really important for good gut microbiome and diversity. Avoidance of antibiotics as much as possible. Of course, sometimes you need them, but I
Hmm.
always work on upstream factors. So if my patients are getting recurrent urinary tract infections or recurrent sinus infections, like let's go upstream and figure out how to stop those so you don't keep needing to use antibiotics over and over.
Oh,
Being
so good.
outside in nature is really important. Figuring out how to minimize stress. I mean, I think a lot of us are living in this like stress and survival mode and don't always know it. It's not good on your
Hmm.
gut microbiome. It's another one. Like I said, nature, pets are really important. I love my dog so much. She's the cutest.
Oh my gosh, I love that one.
Pets are great for your gut microbiome.
Yeah.
Avoiding crappy food, like ultra processed food, that's bad for your gut microbiome. So it's sort of like adding more of the good things, removing some of the bad things. I didn't even mention alcohol, but alcohol is terrible for your gut microbiome. So,
Mm.
removing antibiotics and pesticides and alcohol and ultra processed foods and adding fiber and nature and stress relief and being outside and walking. I will also say in those like pots, is birth control pills. Like birth
Mm.
control pills are not great for the gut microbiome. There's other medications as well that can be negative to the gut microbiome. Whereas like HRT might actually help the gut microbiome. There's some
Interesting.
like pretty early studies on that, but they would suggest that, and I have seen clinically that it's helpful for gut health.
Wow, which would be very cool to see that as
Mhm.
well. That's really helpful too. Okay, there's things that we can minimize and things to add more of to help with our gut diversity for it. Also, as far as like a thyroid and HRT, if you're optimizing your thyroid health, is that going to also make your HRT more effective?
Yeah, maybe, maybe. I would say actually your HRT is probably going to make your thyroid more effective. Um, but I wonder if the opposite is true, and I would suspect like it probably is. So here's an interesting one too. Testosterone might mean like if you go on testosterone, you might need less thyroid medication. So I'm just trying to think. If you want a thyroid, would you maybe need less estrogen or less thyroid or less testosterone? I haven't so much
Right.
seen that clinically, but I mean, it's definitely a part of the puzzle.
Yeah. Because you're like everything's so synergistic
I
the
mean, you
way it
can't,
works
yeah,
together.
like can't go on estrogen and progesterone and like have poor thyroid function. Like that's not going to get you very far.
Right, right. Well, and also like on the flip side of that, would there be any risk in starting HRT
Mm.
if a thyroid dysfunction is unaddressed?
Yes, that's a great question. And clinically, I've seen this come up.
Okay.
So I've had a few patients who were like, they started HRT and they're like, oh, they were expecting, like, they had high hopes and they were like, didn't do well with it. And so we got to step back and like, okay, well, what went wrong? And I think it's usually because estrogen isn't well tolerated if you have hypothyroidism. I think you've got to fix the thyroid piece first, fix the hypothyroidism first, and then layer back in estrogen.
Okay. And you're like clinically, I've seen this happen where
Yeah.
it's like, oh, HRT wasn't the magic
Hmm.
pill that I thought it would be, but there's
Yeah.
really probably some underlying thyroid issues. And then like also for women already on a thyroid medication, how might HRT also
Hmm.
affect their dosing? I know you said you're having clients come in or patients come in every like
Yeah.
6 to 8 weeks for testing, but how might that affect their HRT dosing as
So
well?
transdermal estrogen's probably not going to affect it, but I would check it. And nonetheless, like if you're on thyroid medication, you start transdermal estrogen, I'd always recheck your thyroid hormone after. But no, transdermal is going to have less of an effect than oral. And
Okay.
oral estradiol is going to have less of an effect than birth control pills.
Mm,
And birth control pills and pregnancy are both going to be like on that top kind of, we know they're going to very likely affect thyroid.
top tier.
Testosterone is going to also check your labs again. It's like it might warrant less thyroid medication. You might be able to reduce your dose of thyroid meds if you start testosterone.
So good. That's really, really helpful. And it's like that's where actually recently did an interview with Sam Miller. I'm not sure if you're familiar with him, but we talked about Ann Vince Pitstick as far as birth control pills. And it's like just here's the information. Like I know for lifestyle factors, sometimes the pros outweigh the cons, benefits outweigh the rest. But also it's like it's such a sad piece of information that like the effect it can have on so many things, including your like you shared today, your gut,
Yeah.
your gut health. Like you said, that's kind of top tier that in pregnancy, the way it can
Mhm.
impact things. So good information to have and then do with it what we will.
Yeah.
Right. So good. Well, and also could you share too, like, what are some common symptoms that women might attribute to just getting older, you know,
Oh my
or
gosh,
like
so many.
that might actually be like thyroid related.
Yeah. Fatigue, weight gain, hair loss, low libido,
Mm,
not feeling like myself anymore, anxiety,
mm,
depression. I mean, so much. I think this is the message that a lot of women get as they get older is like, well, you're getting older. I mean, I don't blame them, right? Like
yeah.
they're
Yeah.
told, they're literally told, well, you're getting older. This is just normal. Like your 5 or 10 or 20 pounds of extra weight that you want to lose is not going anywhere because you're just getting older. Um, and I have a lot to say about that, but none of it is confirmatory. Like, I think we go through perimenopause and menopause and we need different things. Just like our daughters go through puberty. They need
Mm.
different things. Our bodies change.
Oh, that's
We
so
just
good.
need to know how to support our bodies in a different sort of way as we get to this phase of life.
Oh, man, that is such a good parallel to make. Like how we support our bodies going, transitioning through puberty and those things. But then, like, this stage of life has been
And you're
very
like, just throw in the
overlooked.
towel.
Yeah,
Like,
it's
forget
fine. You're
that.
just,
Hell no. That's the craziest. I mean, that makes me oh, it gives me a lot of fire, honestly. Like it is why I do what I do because I see women who are sort of dismissed all the time and gaslit for symptoms, and so many women just are really encouraged to give up on themselves. I mean, there's a movement right now
hmm
suggesting we should not care, and it's funny. There's humor behind it, but it's part of the there's like some underlying thread culturally that women should care less about themselves and care more about everybody else
Mm,
and give up on themselves ultimately. And I very much disagree with that.
me too. Very much so. Oh, yes. Yeah, and it's like I know exactly what you're referencing. It's like almost just like a humor of like, well, oh well, you know,
Yeah,
just
like,
like have the extra glass of wine, whatever.
yeah,
That's the way I'm gonna care for myself now. It's fine, you
yeah.
know. And there's so much better to be had. Actually, a part of your post as well, in reference to the body composition piece. The
Mhm.
initial post that had me reaching out to you is you were also just sharing. You're like, you do not need to shrink. You need more muscle. That's like where, so many women are trying to lose weight and they think that's the answer. It's like, no, you need more muscle. And I think you said something like, if you're trying to lose weight in your 40s by more cardio, eating less, like here's your
Yeah.
sign to stop that.
Yeah, and the eating less keep they that's a big piece of it. So many women are restricting their food and that can backfire. Like I mentioned with the
Mm,
thyroid conversion, like you know how it works. Like how's your metabolism gonna adapt if you're not eating enough food? Like not
not
very
well.
well. It's gonna protect you. Like our bodies love us. Our this contrary to what
Hmm.
people think, like your body loves you and is trying to protect you.
Mm,
And we have to step back and think like, okay, well, if you're not feeding your body's going to try to protect you by slowing down your metabolism.
mm,
And that's just how it goes to stay alive. We're prioritizing survival above staying skinny or
mm,
survival above even reproduction or having children. We're prioritizing survival above digestion sometimes. And so we just have to remember that. And yeah, your body is not like, we're not designed for 600 calories a day. Like, we really have to nourish our body. Yes, there's like, it's like too much and too little are both a problem for women who want to lose weight. You got to get like in that sweet spot where you're eating enough to fuel your workouts and to fuel muscle growth, and you're in a good catabolic state, or rather anabolic state, not a catabolic state where you're like breaking stuff down. So
It really is that sweet spot for
it
each
is. And like
each
thyroid is
person.
like you got to get in that sweet spot. I see it all the time because we focus on certain parameters in our labs. So like if somebody has low leptin and a high reverse T3, I know they're underfueled.
Mm-hmm.
Like either you're not absorbing what you're eating or you're not eating enough of it. And often it's like women aren't eating enough of it. And so we just have to, change some habits there.
So good. So, so good. And if you would share, and if anything else you would like to add to this conversation too, but I think one of my last questions for you is just like what, someone listening to this, like what practical steps can they take, what the woman listening to this right now, like if she suspects that her thyroid is not optimized, and even if her labs look normal or what she's
Mhm.
gotten so far, like where would you practically lead her next
Yeah,
to
I
get
mean,
some
I
help?
think that getting a more comprehensive thyroid panel is really important. And I also understand it's hard to know what to do with it
Mm,
because if your doctor doesn't really practice through that lens, and, let's just say like this person doesn't have access to seeing a functional medicine doctor, uh, I think part of it is listening to podcasts like this. Go read my article on Hashimoto's and hypothyroidism. I outline all the like normal parameters. I do think it's important for women to educate themselves and learn as much as they can. And you're not your own doctor. You're not even a doctor. You can't prescribe medication. It's not your job to know all of this.
yeah.
But it does sometimes take you advocating for yourself and finding the right doctor who can help you. So I do
Mm,
think there are a lot of doctors out there who can help, but unfortunately, where we are right now, it requires women to really like advocate and ask around. I think if you go on, certain like Facebook groups or something, you can ask around in your community to try to find somebody like who can help you, who knows. Um, Sometimes endocrinologists can be a little bit more helpful, honestly, and sometimes not. It really depends on, the specialists that you're seeing. But I think the
mhm.
biggest deal is don't give up on yourself. Don't quit. If you know something's wrong, keep looking for it and advocating for yourself and finding somebody who can help. Because at the end of the day, sometimes it's not thyroid. But if you have symptoms suggesting that it's thyroid and you are like certain something's wrong, something is wrong. It just might not be that. Might
Mm.
not be, there might be something else. And so really it's just like finding somebody who can help you navigate this stuff because it is complex. And I wish I could see like everybody, but I just can't. Then I Like it's part of it. But I try to get on podcasts like this and educate because that is where women start to understand, like, oh, okay, they can kind of put the puzzle together and hopefully get
So
some data.
helpful.
I will say too, there's you can go get this data on your own. You don't need a doctor to order it. Like Mark Hyman's got Function Health Labs. You can get that whole panel done. You can go through other, third parties and get a full thyroid lab checked. It's not that expensive, $100 or so. Function Health is more like $500, but
Okay. But
um,
that theirs is like very,
you
very
get a
comprehensive.
lot more
A lot.
parameters.
Yeah.
Yeah, it's not just thyroid. You're looking at all your cardiometabolic risk factors, a bunch of autoimmune risk factors. So it's a really good comprehensive panel. But um, yeah,
So good.
I wish there was easy answers, but
I
I think
know.
just start
And
and
it's
show up for yourself.
yes. Well, it's something too to that point. Like, it's like, yes, it's nice when things are covered by insurance and that kind of
Yeah.
stuff. But also it's like for something that's been plaguing a woman for so long, you are worth that $500 or whatever it is to
Hmm.
go get some answers, like
Yeah.
this has been plaguing you for years or whatever. And I'm going to ask you a question that I always say it depends when people ask me in my field of practice for like, how long is this going to take?
Oh
Or
yeah.
like, as far as results, right? Like,
Hmm.
so for me, and that's a very big sliding scale depending on the person. But if you were to kind of just give like an idea of parameters when someone, if they start addressing these things with their
Hmm.
thyroid and HRT, like when could they expect to see improvement? And then
Yeah.
also like the results.
Yeah. So I think in my practice, 6 to 9 months. Like 3 months is when people start to get all this data back and we can start to like see some improvements and move things in the right direction. So like we're moving in the right direction, but 6 to 9 months is like when the magic happens. That's when people are like, oh my God, I feel like myself again. Like I had no idea how good I could feel. And, then we
Mm,
keep building on that. But that's in my practice where we're addressing gut health and hormones and autoimmune disease and all the lifestyle factors. And so I think it depends on how much you're addressing, right? Like if it
hmm
depends if you're just starting on thyroid medication or just starting on HRT, like it depends if you have other underlying risk factors or other underlying issues and if those are being addressed or not. Because I think
mm,
ultimately you're not going to get very far if you're not addressing these underlying issues. If you've got, an imbalance with your gut or autoimmune disease that's unaddressed and things like that. But I think the big goal is like moving things in the right direction,
yeah,
small
yep,
improvements add up over time. Um,
yeah.
and yeah, it's like that factor of, how much are you doing? How much are you addressing?
Yep. How much are you addressing? How diligent are you being? Like what puzzle pieces are you putting into play versus the next person?
Yeah.
And I think like for some people it can sound like, oh my gosh, daunting, 6 to 9 months. But it's like two things. One, you're probably gonna already start to see improvements, like you said, even around 3 months, like, oh, I'm feeling a little different, things. But like also it's like how long have you been struggling with this too?
Yeah.
For years for a lot of people. So in the grand scheme, it's really not that much time for your
Yeah.
body, gotta be like gracious with our bodies to change too.
Yeah.
So it's so good. Well, thank you so much for your time. And I just appreciate you. Like you said, you can't work with everyone, but doing podcasts like these is just so helpful. And I know there's going to be women listening to this who are probably going to go take action because they're like, oh, okay, that's me. I should go.
Yeah.
I should go get help. So thank you so much. And where can everyone find you? What's the
Yeah,
best way?
my website's drchristinemaren.com. So it's
Awesome.
Maren, and I'm on Instagram at the same handle, Dr. Christine Maren.
Perfect. I will put that in the show notes for everyone as well. But thank you so, so much for your time today. We appreciate it.
Thanks for having me.